Lagos remains the epicenter of COVID-19 in Nigeria. And now that the state is experiencing a second wave, her government, which has been in the forefront of managing and curtailing the spread of the virus, is intensifying efforts to reduce the mortality rates. Lagos State Governor Babajide Sanwo-Olu, who doubles as the incident commander of COVID-19 response in the state, appears to be a step ahead of the virus as it recently initiated measures to contain the second wave and ensure infected patients get quality care.
We have started building what we call oxygen tent, oxygen facilities. We're building about 10 of such facilities. I think we've commissioned about 4 or 5, of them, and we're also building proper oxygen plants, additional to oxygen plants in the state, so that we can meet, the respiratory requirements. We understand the virus more than where we were 10 months ago or 8 months ago.
Contrary to alleged comments that has gone viral on social media, a visit to the Infectious Disease Hospital, Yaba, which hosts various wards of isolation centers, depicts a different scenario. This is where patients who come into the IDH are firstly attended to, and thereafter, anyone who has difficulty in breathing on arrival is immediately placed on oxygen at no cost. To isolate and ensure positive patients do not infect others, they are taken to these single-bedded wards. There are over 3 sample collection centers in the IDH, and people are trooping in to get tested. In an exclusive meeting with the Commissioner for Health, Professor Akin Abayomi, whose office is now at the IDH, he explained steps being taken and deliberate preparations should there be an escalation of the second wave.
To keep up with the demand, our supply had to increase and our efficiencies had to increase. So we did a number of things. We recruited more suppliers into our pool. So instead of collecting oxygen from 3 or 4 places, we're now collecting from about 6 places. We still want to, in Lagos, have that kind of preparedness so that if we come across something like this again, or COVID lasts for another year or 2 in multiple waves, or we have a flu outbreak, that we have the infrastructure to respond to a massive need for oxygen.
During the tour around the IDH led by Professor Abayomi, the team noticed an oxygen pipe connected to the ICU and other wards.
We've just expanded it so that there's never a shortage of oxygen in ICU. Plus you can see extra cylinders. So when this 1, 2, 3, 4, 5, 6, when they empty, these ones will just be put. And we get a dedicated supply of oxygen for ICU. It's separate for the hospital.
Initially, we have had to move cylinders into each ward and give oxygen to each patient with mask. But now we have piped the wards so that there is a manifold that, assesses oxygen directly, 6 cylinders at once. It's piped into the wards and it has an alarm system that goes off whenever it's really low. It's more decent, it is more efficient, and then it conserves oxygen. It reduces wastage, and then we're sure that, we don't go off, nobody dies because oxygen goes off abruptly.
As the need for oxygen increases, the Lagos State government also installed this oxygen plant to enable patients get access to oxygen at the various centers. This oxygen plant can generate 60 light cylinders in 24 hours.
On the request of Mr. Governor, that we needed to generate our own oxygen. So for you to generate your own oxygen, you need a plant. And this is a plant. What the plant does is it takes normal air. So in normal air, your percentage of oxygen is 21%. If you and I, we can survive breathing in normal air because 21% of oxygen in normal air is enough for me and you. But if your lungs are injured, and they're not functioning properly, then we need to raise the concentration of oxygen that you're breathing in. Ordinary air will not be enough. So what we give you is 99% oxygen.
One of the earliest decisions taken by the state government is the establishment of this biosecurity lab for infectious diseases.
This is very expensive technology, and it's put in here so that our staff are safe, and the equipment in here is what does all the testing across Lagos. So everything from all the public health response comes mainly to this laboratory.
Here is the COVID isolation ward. It is a different scenario entirely. Though the patients have access to care free of charge, but their conditions confirm the threat of the second wave to the human respiratory system. As patients are brought in on a daily, many are also recovering and getting set to be discharged.
I feel much better. In fact, I've just been told I can go home. I've been here since Friday afternoon, and the experience has not been an unpleasant one. The nurses and the staff are generally very helpful.
The treatment there is perfect. Everybody is working hard. I'm much impressed. You know, Lagos is the father of Yoruba land, so they're taking care of everybody.
Obviously, it is not a comfortable situation for patients here, as majority are gasping for breath and surviving on oxygen. It is either you are staying safe out there by complying with all COVID-19 safety protocols, or you are in here struggling for survival.